I want to ask you something most doctors are too uncomfortable to discuss. What actually happens inside your body if you stop ejaculating after 60? Is it healthier to hold back? Does releasing more often drain your vitality? Or does stopping altogether protect your prostate or slowly destroy it? I've had men in my exam room tell me they stopped completely, some by choice, some because life just got in the way, and they had no idea what was happening inside them. And I've had men on the opposite extreme, worried they were using it up. Today I'm going to give you the honest, science-backed truth. No embarrassment, no judgment, just facts, and a clear path forward. I'm Dr. Emily Carter, a urologist with 12 years of experience helping men over 60 reclaim their vitality, strength, and confidence. I've worked with thousands of men who thought their best years were behind them. They weren't, and neither are yours. Before we go further, hit that like button right now and drop a comment telling me where you're watching from. It genuinely helps me understand who I'm talking to so I can keep creating content that actually helps you. Here's the problem, gentlemen. We live in a world that either over-sexualizes men or completely ignores their health after a certain age. Nobody sits down with a 62-year-old man and says, "Let's talk about your ejaculatory health and what it means for your prostate, your testosterone, and your emotional well-being." Nobody. So men are left guessing, picking up myths from the locker room or half-read articles online. And the myths are everywhere. Saving yourself makes you stronger. Releasing too often weakens you. Stopping completely cleanses the body. None of this is grounded in real science, and some of it is actively harmful. Here's what I see in my clinic. Men who stopped releasing regularly, whether due to a difficult relationship, low confidence, or simply not knowing it mattered, starting to notice things. Their urinary stream getting weaker, a dull heaviness in the pelvic region, a quiet but persistent drop in mood and drive. They connect none of it to their sexual health because no one ever told them there was a connection. And on the other side, men who were told that releasing frequently was somehow shameful or a waste of energy, holding back, suppressing, and quietly suffering for it. The truth is, ejaculation is a biological function. Just like your heart needs to pump, your lungs need to breathe, and your bowels need to move, your reproductive system has its own rhythm of health. Disrupting that rhythm has real consequences. Let me show you exactly what they are. The first thing that happens when you stop releasing regularly is what I call prostate stagnation. Think of your prostate gland like a small internal sponge that continuously produces fluid, prostatic secretions that are rich in zinc, enzymes, and compounds that protect sperm and support urinary health. When you ejaculate, that fluid is expelled, and the gland essentially flushes itself clean. But when ejaculation stops or becomes very infrequent, that fluid doesn't go anywhere. It pools. It stagnates, and stagnant fluid creates an environment that can promote inflammation. In clinical terms, we call this prostatic congestion. It's associated with discomfort in the pelvic region, increased urinary urgency, a weaker urinary stream, and in some cases, it can trigger or worsen a condition called chronic prostatitis, inflammation of the prostate. Emotionally, this is something men rarely connect. They notice they're more irritable. They're getting up 2 or 3 times a night to urinate. They feel a vague pressure that's hard to describe. They assume it's just aging. Often it isn't. Often it's biology asking for what it needs. Practically, here's what the research tells us. A landmark study followed nearly 30,000 men over 18 years and found that those who ejaculated more frequently, 21 or more times per month, had a significantly lower risk of prostate cancer compared to those ejaculating 4 to 7 times per month. Now, correlation is not causation, and prostate cancer is multifactorial, but the signal is consistent across multiple studies. Regular ejaculation appears to be protective for the prostate. My recommendation for most men over 60: aim for a minimum of 2 to 3 times per week, whether through sexual activity or, if necessary, self-release. This is medicine. This is maintenance. I want to tell you about Robert. Robert was 67, retired, and had been in a low-intimacy marriage for nearly a decade. He came to me for what he described as prostate problems, urgency, frequency, some pelvic discomfort. After ruling out infection and malignancy, we talked honestly about his history. He hadn't ejaculated in almost 2 years, not once. I explained what was happening physiologically. He was quiet for a moment. Then he said, "Doctor, I thought I was just getting old." We put together a simple plan. 6 weeks later, he called my office to say the urgency had dropped dramatically. The discomfort was nearly gone, and, his words, "I feel like myself again." The second consequence of stopping is a hormonal cascade that most men never see coming. Here's the biology. Sexual activity and ejaculation are tied into your hormonal feedback loop in complex ways. There is evidence that regular sexual activity helps maintain luteinizing hormone signaling. That's the hormone that tells your testes to produce testosterone. When sexual activity drops off completely, some men experience a gradual but measurable decline in free testosterone levels beyond what age alone would cause. Now, I want to be precise here. Ejaculation itself doesn't directly create testosterone, but the behaviors, confidence, and physiological arousal that accompany a healthy sexual life do appear to support the hormonal environment that testosterone needs to thrive. Here's the emotional reality of this. Low testosterone doesn't just affect your libido. It affects your mood, your motivation, your ability to concentrate, your sleep quality, and your sense of identity as a man. Men describe it as feeling flat, like someone turned the brightness down on their life. They don't recognize it as hormonal. They think they're just depressed or tired or getting old. Sometimes they're right, but sometimes the root is biological and addressable. Practically, if you've noticed a persistent low mood, reduced drive, fatigue that sleep doesn't fix, or a quiet withdrawal from the things that used to energize you, ask your doctor to check your total and free testosterone, a simple blood test. And separately, begin reintroducing regular sexual activity into your life. Think of it as exercise for your hormonal health. It won't solve everything, but the absence of it has real costs. The third consequence is what I call the confidence spiral, and it's perhaps the most damaging of all. Here's what happens neurologically. Intimacy, arousal, and sexual release trigger the release of oxytocin, the bonding hormone, and dopamine, the reward chemical. These aren't trivial. They are core to how human beings experience connection, pleasure, and purpose. When men stop engaging with their sexuality entirely, they lose a meaningful source of these neurochemicals. What fills the void? Often anxiety. A quiet but growing sense of disconnection from partners, from their own bodies, from life itself. Men who stop releasing entirely often report feeling invisible. They stop pursuing intimacy not because they don't want it, but because time has passed, and the longer the gap grows, the more intimidating it becomes to close it. Emotionally, men carry enormous silent shame around this. They don't tell their doctors, they don't tell their wives, they quietly assume something is broken beyond repair. I am here to tell you directly, it is not. Practically, if you've been in a prolonged period of sexual inactivity, don't try to go from 0 to 60. Start with reconnection. Physical affection with a partner, open conversation about what you're both experiencing, and if needed, a consultation with a urologist or sexual health specialist who isn't embarrassed to have this conversation with you. Erectile function, desire, and confidence respond to consistent, patient attention. I've watched men in their 70s restore a sexual life they thought was permanently behind them. Marcus was 71 when he came to see me. He'd been widowed 4 years earlier and had been completely celibate since. He wasn't there about sexual health. He was there for a routine check. But when I asked about his quality of life, something cracked. He said, "Doc, I just feel like I'm waiting, like I'm already halfway gone." We talked for a long time. About grief, about biology, about what his body still needed even now. I referred him to a counselor. We checked his hormone levels, low but correctable, and I gave him permission as a physician to reclaim that part of himself. 18 months later, he sent a note to my office. He'd met someone. He was, in his words, fully alive again. The fourth thing that happens when you stop releasing is a phenomenon I call the atrophy cycle. Use it or lose it, but for your reproductive system. The penile tissue, The erectile chambers, called the corpora cavernosa, require regular oxygenation, and that oxygenation happens primarily through erections. Nighttime erections, morning erections, arousal-based erections. These are not just sexual events. They are physiological maintenance. They deliver oxygenated blood to tissue that otherwise has very limited circulation. When men go long periods without erections, whether from complete sexual inactivity, psychological withdrawal, or underlying vascular issues, that tissue can undergo fibrotic changes. Collagen replaces smooth muscle, elasticity decreases, and over time, erectile dysfunction can worsen not because of one clear cause, but because the tissue itself has been left without the oxygen it needs. Think of it like a rubber band left in a drawer for years. It doesn't bounce back the same way. Emotionally, this is one of the crueler ironies. Men who avoid sexual activity because of anxiety about erectile performance often accelerate the very decline they fear. Avoidance breeds atrophy. Engagement, even imperfect, even modest, protects function. Practically, if you're not having regular partnered sex, regular arousal and self-release maintains penile oxygenation. If you're experiencing erectile dysfunction, speak to a urologist. There are excellent, well-tolerated medical options, PDE5 inhibitors, vacuum erection devices, and others that can break the atrophy cycle and restore confidence while we address underlying causes. And finally, number 5, the one most men completely overlook, pelvic floor dysfunction. Your pelvic floor is a hammock of muscles at the base of your pelvis. It supports your bladder, bowel, and prostate. It plays a direct role in ejaculation, urinary control, and erectile function. In men who have been sexually inactive for extended periods or who have never been taught to think about this part of their body at all, the pelvic floor often becomes either chronically tense, which contributes to that pelvic pressure and urgency I mentioned earlier, or progressively weakened. A weakened pelvic floor means less ejaculatory force, poorer urinary control, and reduced erectile rigidity. A hypertonic, overly tense pelvic floor causes pain, urgency, and sexual dysfunction. The good news, the pelvic floor responds remarkably well to targeted exercise at any age. Kegel exercises, which most men have never been taught, can meaningfully improve urinary control, sexual function, and pelvic comfort within weeks of consistent practice. Here's how to find the right muscles. Next time you're urinating, try to stop the flow midstream. The muscles you use to do that, that's your pelvic floor. Now, away from urination, practice contracting those muscles for 3 seconds, then releasing for 3 seconds. 10 repetitions, 3 sets per day. Build to 10-second holds over time. It's quiet, it's private, and it works. Here is your simple action plan. 5 things starting today. Step 1. Aim for regular ejaculation at least 2 to 3 times per week. This is prostate maintenance and hormonal support. It is not indulgence, it is healthcare. Step 2. Get your testosterone checked, total and free, if you've noticed persistent fatigue, flat mood, or reduced drive. A simple blood test can tell you a great deal. Step 3. Start pelvic floor exercises today. 10 Kegel contractions 3 times daily. Build the habit this week. Step 4. If you've been avoiding intimacy due to performance anxiety or erectile concerns, book an appointment with a urologist. There are options. There is no reason to white-knuckle this alone. Step 5. Talk to someone. A partner, a counselor, a doctor. Sexual health in men over 60 is still taboo, but it shouldn't be. Your silence isn't protecting you, it's costing you. If you've been sitting with frustration or embarrassment or a quiet grief about this part of your life, I want you to hear me clearly. You are not broken. You are not past your time. Your body has not abandoned you. Biology is asking for something specific, and now you know what it is. The men I've watched reclaim their vitality after 60, after 65, after 70, didn't do it through miracles. They did it through knowledge and through the willingness to stop pretending this didn't matter. It matters, you matter, and it is never, ever too late. If this video gave you something, a new understanding, a sense of relief, a piece of information you wish you'd had years ago, please like it and share it with a man in your life who needs to hear this. Most men will never bring this up on their own. You sharing this might be the thing that changes his health. Drop a comment below and tell me, what's one thing from today's video that surprised you most? I read every comment, and your responses genuinely shape what I cover next. And subscribe. I release new videos every week covering everything your doctor doesn't have time to say in a 10-minute appointment. I'm Dr. Emily Carter, reminding you that after 50, vitality isn't lost. It's waiting to be awakened. Take care of yourself, gentlemen. I'll see you in the next one.